Hi, my name is Dr. Ari Namin, and in this video we are going to be discussing the melolabial flap. First, we'll discuss the circumstances in which this is a good reconstructive tool. Next, we'll discuss a little bit about how the procedure is performed, and then we'll finish up with the risks and benefits to the procedure. So, the melolabial flap can be used to reconstruct cheek defects as well as nasal defects. Most commonly, I utilize this to reconstruct nasal defects. And in particularly, I utilize this to reconstruct defects of the nasal ala, which is this part of the nose here. One reason why the melolabial flap is a good option for this is because of its close proximity. The skin right here on your cheek is in close proximity to the nasal ala. And also the skin typically matches fairly well. The skin of the cheek here typically matches decently well to the nasal ala. And so what we do is we leave it pedicled to your body so that it has a blood supply. And most commonly, we need a flap that maintains its blood supply because when we're reconstructing defects of the nasal ala, we oftentimes have to add support in order to maintain your nasal breathing. And so that oftentimes comes in the form of either a septal cartilage graft, an ear cartilage graft, or even a rib cartilage graft in more extensive cases. And when we place a rib graft into the nose, it's important that we give that graft a good blood supply so that it can stay alive. And that's why we need to use a pedicled flap. And those flaps maintain their blood supply for a period of time. And so the melolabial flap is left attached for about 3 weeks. And this diagram helps explain it well. In the upper left-hand corner, you will see a nasal defect of the nasal ala. In the upper right-hand corner, you see an ear cartilage graft within the defect, and this is providing support to the nose. And then you see the designed melolabial flap. This is the portion of the cheek that will be rotated up to your nose to help reconstruct this area. In the lower left-hand corner, you can see what your face will look like during the period of 3 weeks between the first and second surgeries. You'll have an incision along your cheek that is closed with sutures, and then the flap will be sutured to your nose. There will be a bridge of tissue connecting your cheek to your nose that will remain in place for 3 weeks. There will be a small area of exposed flesh. After 3 weeks, once this tissue has healed well into the nose, we go back for a second surgery to remove the intervening bridge of tissue. And at that point, we complete the inset of the flap into your nose. If we need to take a cartilage graft, we can either use the nasal septum, the ear cartilage, or the rib cartilage. If we use the nasal septum, we usually make a small incision on the inside of the nose here to expose the nasal septum, and we're able to harvest cartilage in that way. You may have splints in your nose after a septal graft harvest, and you'll have some nasal pain after this. There's also a risk for nasal bleeding. If we take cartilage from your ear, I usually make an incision along this structure here, the antihelix, and dissect the skin off of the cartilage, both on the anterior side and the posterior side. And this allows me to harvest the cartilage in your ear that does not provide support to your ear. And so it shouldn't change the appearance of your ear, and the incision typically heals very well. The ear cartilage does serve well for the melolabial reconstructions of the nasal ala, because the shape of that cartilage matches well with the shape of the nasal ala. And so it helps give support and helps give that shape that we're looking for. The main drawback of the ear cartilage harvest is that it is a little painful, and so after that can commonly be the most painful part of the surgery. And then lastly, if you have an extensive nasal defect, sometimes harvesting rib cartilage is necessary. And so if that's the case, you'll have an incision underneath your right pectoralis muscle or right breast, and it's usually about 4 centimeters or so. And we dissect through the skin, subcutaneous fat, and then through the muscular layer and expose the cartilage of the rib. And this gives us longer segments of cartilage and more cartilage if extensive grafting is needed. There's a small risk of pneumothorax or a collapse of the lung whenever we harvest rib cartilage. And there's also the associated postoperative pain. Typically, I only harvest the anterior half of the rib cartilage, which helps minimize the postoperative pain, but it still certainly will be present. So lastly, let's talk about the risks, benefits, and alternatives to this procedure. Well, let's start with the benefits. Our goal is to restore your nasal form and function. Our goal is to make your nose look as close to it did before the injury or tumor removal, and also to have it function as well as it did before. However, that isn't always possible. And so one of the biggest risks is that there will be some minor cosmetic imperfections, and there may be some residual nasal breathing issues. And so while our goal is to give you the best result possible, this can be a challenging reconstruction, and there's always the risk of a cosmetic imperfection or a persistent nasal breathing issue. Similar to other surgeries, there's a risk of bleeding. Part of the flap will have an area of exposed flesh that can sometimes bleed. We usually wrap that with a material that helps prevent bleeding. There's also a risk of infection. However, we prescribe antibiotics to help minimize this risk. And given the high vascularity of the face, isn't a common problem encountered. There's the risk of bleeding from the inside of the nose or epistaxis. And whenever we're doing a reconstructive procedure that involves a flap, there's always the risk of flap necrosis, which is where we're preserving the blood supply to the flap, but that blood supply is injured or just not sufficient in your body to supply the flap. And in those cases, the skin dies, and we often have to go to a different reconstructive option. The alternatives to the melolabial flap are to do nothing. We always have to remember that in nasal reconstruction or facial reconstruction, our goal is restoring form and function, but we're typically not dealing with a life-threatening problem. And so doing nothing is an option. We just have to understand that the appearance may not be what you like, and you may have impaired function of your nose or your face. So in this video, we reviewed the indications or scenarios where melolabial flap is a good reconstructive tool. We reviewed the procedure and how it's done. Specifically reviewed that it's a 2-stage procedure and that you'll have to plan for a second surgery about 3 weeks after the first. And then lastly, we reviewed the risks, benefits, and alternatives. I hope you find this information helpful, and I look forward to seeing you soon.